If we take a puppy and see a large number of fleas, or let's say flea droppings, which look like tiny black specks if you part the fur, you can use various anti-flea products without basing the animal, as long as it is not severely weakened. Because if there are a lot of fleas, let's say, and they start biting, the animal begins to scratch itself, which leads to mechanical scratching that can cause the animal to become depressed or, let's say, weakened. In such cases, it's necessary to take it to the vet. If the animal is active and you notice that it has fleas, there are various anti-flea products available, ranging from drops to tablets and sprays. If there are a lot of fleas, I recommend sprays more, because there are different sprays that inhibit the growth and development of fleas, meaning they die immediately on the spot when you spray them. If you bathe the animal, in any case, it still needs to be treated. Either with drops, preferably 48 hours later, or with sprays, or with tablet medication. It all depends on the season, whether it's summer, autumn, or spring. When it's summer and the peak of the heat, some people use tablet or oral medications for fleas, ticks, parasites, mosquitoes, and so on. And they also use sprays topically, because the animals walk in the grass where there are a lot of ticks, so that the ticks don't even latch on. And some people try to bathe them, let's put it that way. So if there are a lot of fleas, you bathe the animal, but even after that, once the animal dries off, you still need to treat them. But every pet owner chooses what works best for them. Some find that drops costing 300 hryvnias are effective, while others are helped by drops that cost 150. So it's all very individual as well. You could actually cause harm. There are various products that are recommended and claimed to be harmless, but our animals are so small that they start licking themselves, which then leads to vomiting, diarrhea, intoxication, poisoning, and you end up needing to put them on an IV. Why take the risk? That is, it's easier to come to the doctor and tell him that is, each patient, like a child, has his own pediatrician, yes, and also has his own doctor. You go to your vet and say, my pet has fleas. And I can't rule out the possibility that there are fleas in my apartment too, because they can even bite humans. I mean, they can jump, you know how it is. And the doctor tells you, guys, we treat this with such and such products. This could be drops, tablets, or sprays. So it all depends on the owner's financial situation, let's put it that way. You also go to the pet store and buy this or that, or some kind of product that you dilute with water, let's say, and you wash the entire place thoroughly. There are also usually SPR. Either you buy new bedding, or you simply wash the bedding, or the place where your pet lives, let's put it that way. You wash all of that, and when you pick up your pet, if you leave it at the clinic for a day while you treat your apartment, let's say, you bring it back into a new clean space, so to speak. And that would be the right way to do it. Rather than trying to handle everything yourself at home, someone licks something, then, let's say, throws up somewhere, then you go back to the clinic again, then you have to do another IV and so on, and it just never ends, so to speak. Some people treat every 3 months, some treat every month and a half, and some use special drops every 5 weeks, or with tablets, let's say. So the medication that is suitable for that particular animal. There are instructions included. In those instructions it says, for example, that prevention is recommended every 5 weeks, right? Or prevention is recommended every, say, 8 weeks. So based on that, the owner understands what they need to do. Sometimes there may not be any fleas present, but an allergic reaction to the parasite saliva can still occur. So the animals scratch themselves, let's put it that way. In other words, it might not even be interesting for the flea to live on them. So the flea jumps on, bites, and jumps off, so to speak. It's like a mosquito that bites us and then flies away, right? Because the saliva gets into the blood, we start to scratch, the allergic reaction happens. It's the same with animals. This means that the animal hasn't been fully treated. So this can also happen. This is only relevant if you are still using either drops or sprays, so to speak. But in my experience, as practice shows, if you only use a collar, it usually doesn't work. I have people, I have patients who wear collars and are also treated at the same time, and in that case it works. But very often, also, if you wear a collar and don't use any other treatments, then it's kind of not enough.